Hi, welcome to Health Talk with Nicole and Dr. Martha. I'm Nicole Tatro.
And I'm Dr. Martha.
So today, I've decided that we're going to talk a little bit about this amazing manual technique that I discovered a few years ago called Bowenwork. Lots of people don't know what it is, and I realized this past weekend I was out with my hockey families, and I was sitting next to a fellow hockey mom, and we were talking about her daughters, both of which have an issue with their muscles and tightness and Achilles tendon stuff, and we were talking about those things. And I said, well, you should have them come see me. And she basically said, she goes, I wish I would have known about you. So I'm failing in the category of educating of what I'm doing right now. So I figured this would be a good start.
I think it's great. As a chiropractor, I really don't know much, but I do know that a lot of my patients have received a lot of benefit from that treatment. So I'm very excited to learn more about it today.
It's pretty exciting. I actually discovered it in a fork in my own personal road, and I decided that I just needed something else. So I found it, and it took me a few months before I actually signed up for my first course. And the closest course was about 4 hours away in Peterborough, New Hampshire.
Wow.
And so I went, and after, on my way home, it was a full weekend course, 2 days, and I was driving in the car, and I went through a bunch of emotions, excited, sad, all these things. I was crying, and then I decided, I'm like, this is the rest of my life. This is what my career will be. And that was just after the first, we call them modules, module 1 and 2. And basically, it's a manual release technique that it just goes so deep in the body. And we can get a little scientific today. But the late Tom Bowen discovered it, and he didn't write anything down in the beginning. He just did it. He said he had the gift from God because he wasn't a chiropractor, which back then they called him the bone crackers.
Right.
He wasn't a rubber like a massage therapist. And so it's funny you hear about this history. So he was actually shunned in the community because he didn't have this, important background. But he had results. He saw, I think it was thousands of patients and just amazing results. He used to see children for free. And they joked about him seeing people on a twin bed. He didn't have all these fancy tables that we have nowadays. But Tom Bowen passed, and before he passed, he decided that he better bring on some students. So he brought on some students, one of which was Aussie Wrench, and they were all from Australia.
Oh, wow.
Yeah, so
Should we talk like them? I really
know.
can't. But.
There wouldn't be a way I wouldn't be able to. So what's really, really cool, and I'm all over the place with this, but I've got to meet Aussie finally last summer. He actually came to Canada, and not very far, so I was able to jump over there and meet Aussie and his wife Elaine. And so Aussie had studied from Tom, and he and was able to put together all the manuals that we now study from.
So what is the biggest difference between the Bowen treatment and what we consider to be traditional physical therapy treatments?
I was obviously traditionally trained and practiced for several years doing traditional techniques. Now, obviously, I have the best of both worlds because I still do some traditional stuff, but most of what I do I find is not necessary. I can do the Bowen work. What I'm finding is this is less is more. Instead of more is more. I don't know. I feel like, I know that's not really a phrase, but that's how I feel like I was taught. Like if you look at my thumbs, I did trigger point release and ripped up my ligaments just by going in deeper and harder. And with Bowen work, it's a lot less. In fact, if you go less, sometimes you're affecting more things like the lymphatic system. So very, very neat. Another thing they said was, for instance, the difference between massage, which I think is, highly beneficial. Sometimes that's inflammatory, where we're breaking things down to build it back up, whereas Bowen is anti-inflammatory. So I've actually seen people after a treatment. I had a lady come in, terrible, terrible swelling. We were joking because she was falling out of her Mary Janes, like her swelling was coming up over her ankles out of her Mary Janes. And I saw her on a Monday. By Wednesday, she called me and said the swelling was completely gone because of a particular technique I had done to open up the channels and then let the lymph kind of take care of the swelling.
So one of the things I see a lot of are patients that are post-cancer, post breast cancer, post, other types of cancer. I have one patient that was post uterine cancer, and they have a lot of issues with lymphedema after they remove the lymph nodes. So this is something that could help with that.
Absolutely. And what's really great, and why when someone says, well, can you help with A, B, C, D, all the way through the alphabet? And I say yes, because we can treat anywhere from the elderly to infants. I've actually treated a lot of infants. I've treated my babies all the way through. Especially my Bowen baby, Ella. She was in my belly when I was studying, so we joke that she's a Bowen baby. But yes, because it's so gentle, because some people are very sore.
Yeah.
And yes, it can get it. There's a huge lymph pump right in here that we make this gentle move that's incredible, and I actually do it on myself sometimes if I'm feeling a little bit kind of congested. But I do it on my assistant, Jess, and she's like, oh, she almost gets dizzy. She's like, oh, I need it. So absolutely.
Well, let's talk a little bit about that. The lymphatic system is your detox system. So
it's like your sewer system.
Yeah, all your dead cells and everything from the blood gets filtered, and then it goes back through your lymphatic vessels, and those vessels travel pretty closely to the cardiovascular system, and they kind of go back and forth, between the capillary plexus. So what ends up happening is you get this diffusion of all that, the dead waste, the phagocytic, that's what we call when you break down cells. So the lymphatic system can get really backed up. Like you said, it's kind of like your sewage
all
system.
Of us. Absolutely.
So it's great that helps with that. So what other things, are there particular conditions that you would say that you treat?
Well, I tend to see a lot of people that have done everything and nothing has worked. Okay. So I see a lot of chronic things. But what I'm seeing more and more, and which really excites me, I love my athletes, are orthopedic issues in athletes.
Wow.
And what I'm trying to educate people is that to come see me when they just feel that little aura of something not feeling right, instead of like, okay, this has been going on for 2 years, 3 years. Come when you just don't quite feel right, and let's get you balanced out. That's one of my favorite words. Usually when I see people on their first visit, I call it the balance. You balance out the low body, the upper body, and the neck in the first visit. It's quite remarkable.
Wow.
And usually I see the most changes in that first visit.
So your evaluation is very much the same as
Absolutely.
What you did as a traditional physical therapist.
And because I'm a licensed physical therapist, I take insurance, so I have to go through all, the same note stuff that you do.
Documentation.
Yeah, our favorite part, and you see the eye rolling.
Oh no, we love it.
It is important. But I do a full physical therapy evaluation.
Yep.
And I do some postural stuff as well, and measurements, whatever. If they're coming in primarily for a cervical issue, then obviously I'm going to do cervical measurements. I get a lot of low back pain people. Yep. I think that's a big majority, but a lot of shoulder. It varies. It varies. It really kind of goes.
So really, any condition that's
Anything.
musculoskeletal, you can treat.
Yep.
And in addition to that, things like lymphedema are affected.
Yeah.
So it's a nice, we always talk about side effects is not necessarily a positive thing, but in this particular case, side effects of, the lymphatic system draining better, that's a really good side effect.
A lot of secondary things that obviously aren't a physical therapy diagnosis, but I had a lady when I first started this. She was discharged and she came for a right hip pain, so an orthopedic issue, and she pulled up her pant leg and she's like, look at my leg. And I was like, okay, that's a nice leg. I don't know what to say. And she was so ecstatic that her psoriasis was gone.
Wow.
She said this was the only change that she did was to come see me for Bowen.
Yeah.
And obviously I had no idea. I didn't, we didn't talk about that. It wasn't a primary thing that a typical physical therapist would,
wasn't like she walked
treat.
in,
and said,
I have
that's my
psoriasis,
diagnosis.
can you treat this?
She was so excited about that. So it really goes to show that it starts to balance out the body.
That's excellent.
So my first 2 moves are usually done on the low back. Sometimes I start, especially in a sport injury, if we go right at it. But lots of times when you're coming into the clinic, I have about an hour, hour and a half, depending on, if it's an eval or not. But we have that, length of time to work with somebody. So it gives me time for the people to process. So what's really, really different, I do use the massage table, and I have very quiet rooms. Like, I try to be silent. In a perfect world, it would be silent.
Yeah.
In perfect Bowen world, they don't want any noise whatsoever, silent. But in my clinic, just to drown out office noise or a loud car that goes by, I do have sound machines to help. Some people don't like them. But the first two moves, it goes a little deeper than just, you know, touching the skin and initiating the fascia or the musculature. We're digging into the autonomic nervous system. We're trying to tell the body the emergency is over.
Gotcha.
See, what happens is we have our sympathetic and our parasympathetic. Our sympathetic is our, you know, fright and flight, and that's where most of us are. We're heightened. This is our sympathetic, and our parasympathetic kind of is like, what's that? Our parasympathetic is responsible for resting, healing, digestion. So think about all the problems people have in those categories. So it's quite remarkable on the table. After just a couple moves, people's bellies will start growling, and they'll start apologizing. Oh, I didn't know I was hungry, and I'm doing one of these like you're not hungry. It's your parasympathetic is kicking in. You're able to actually digest.
This is a positive
It's absolutely
response.
a positive. It's very, very exciting.
Excellent.
So it tries to balance out the autonomic nervous system.
So you're going to show us some of your techniques today.
I'm really excited.
Yes, we have Carolyn Weber with us again. She's going to come on out.
I love this so much. She came back. So, if my patient is able, I have them lie on their tummy. That's the most appropriate position because it allows everything to relax and I can get to the structures. The coolest thing about what I do, compared to, say, a massage where you have to fully disrobe, I can work through light clothing. I would have probably, if she was in my clinic and I was coming in and I was going to work her lower body, I might have asked her to bring shorts.
Yep.
But if most of my patients bring in sweatpants or yoga pants and a light shirt or a tank top, and I can work through that, and that makes people really comfortable because they don't feel violated.
Right.
Not that people do with a massage, but they don't really typically want that for a physical therapist.
Right.
So I'll have you lie on your tummy. I do have the face cradle. We don't have to. They even say that if your head's turning one way or another, if possible, it kind of maybe even puts a better stretch through the fascial lines. So I'm actually doing a mini little study in my own practice. Nothing written, just kind of in my head, whether it's helpful or not. I do put their ankles up on a bolster. It just kind of puts their body in the most relaxed position. And again, I'm going to do this through light clothing. And the first two moves I do on the lumbar spine, right on those erector muscles, those long skinny muscles that come through here. And basically, I'm doing a little stretch, pushing down in and challenging for a few seconds. And I also use the breath. I try to make my move after the exhale, and I do a slight roll. That is move 1 of the lower back. Move 2 is on the opposite side. Very light and gentle, and of course some people are sensitive, so I adjust my pressure. We didn't give Carolyn a mic, but how are you feeling? She feels okay. And then there's a couple of moves. Sometimes these are pretty tender. We kind of ignore our buttocks.
Yes, well, we talked about the piriformis muscle, remember? And trapping that sciatic nerve.
I'm rushing this a little just because, I have cameras on me and we're talking. But it's all about going slow and letting the body process. So at this point, those are 4 moves. I would literally leave the room and let her body process. And the processing part is the coolest part. I've had people have responses as simple as some, heat in the area, some aching, sometimes pain, and we educate so that that's not a negative thing, that's just the processing, and we embrace it and we kind of work through it. Yeah. There's sometimes people will have vibrations in their hands. Sometimes they'll feel pain. It'll work itself out and leave the feet. Not even kidding. It's pretty wild. I've actually had people move on the table. I've had people kind of process and work through it by literally shaking. I've done a pelvic routine where I've held the leg and I've had to hang on with 2 hands as the young lady was rotating in my hands, aligning. It's pretty wild. You really almost have to be there to believe it. I didn't believe it the first couple of times. I'm like, does this really happen right off?
Yeah.
It's not magic. It's not a miracle. I am not the healer. I am actually the messenger to send the body a message to heal itself.
So how many treatments does one generally undergo?
It varies. I've had a couple one-hit wonders, and I joke about that because that's few and far between, because most of us traumatize our bodies. One little guy, I think he was 8 or 9, little football player, knee issue, saw him one time, never came back, so I got all self-conscious thinking that, you know, I did something wrong, they didn't like it.
Yeah.
But then I ended up bumping into the mom, and she said, oh, thank you so much. She was able to go back into football.
Wow.
You know, I'm like, just call me next time so I know. And then I had a young lady that came in for neck pain, but she was aware of me, so she came soon.
Yeah.
She slept on it wrong, I think, the night before. She was 95% better by the time she got to the parking lot. And she came a second time just to kind of seal the deal. But she said that, you know, by the time she came back for that second visit, she probably could have gotten through on her own. But most times, after 3 visits, you'll know if this is going to be your thing, for sure. And the really cool thing is, it's probably a bad business move, but I only see people once a week.
Yeah.
But because Bowen works in your body for a good 5 to 7 days after. There's actually there's not a lot of studies because this is new to the U.S.
Yeah.
But, you know, in Australia, no, you know, it takes a while for us to catch on to things. But there is a couple of studies to show, like the heat, thermogram studies to show day 2 and 3 were the most powerful after a Bowen session, and then it started to fade away, but it was still working. Day
so that's
5
showing
and
the
6.
heat in the muscles
Yeah,
themselves.
like exactly,
Yeah.
like wherever it worked.
Nice.
And then one other really cool thing is one of my main instructors, her husband unfortunately had suffered a stroke, so he was in the hospital. So he was hooked up to a lot of monitors, and they were watching brain scans, and she was able to allow them. She had to do some sweet talking.
Yeah.
She did Bowen while he was in the hospital, and she was able to track it, and she did a nice conference on this, but she showed that he went immediately into REM sleep.
Wow.
And so it was really interesting because it definitely, I have patients that go quick, like full snoring on the table after first couple moves.
So is Carolyn still with us, or is she
I'm
sleeping?
I know it's hard because we're in here, but do you feel anything?
I could fall asleep.
Yeah, she's feeling relaxed.
So very relaxed.
So I have...
So it's a very non-invasive treatment, basically.
Absolutely.
And so you were saying it depends on the patient as to how many treatments
Absolutely.
that
Yeah,
you
and
need.
it depends on what they're coming for. When someone
Yeah.
comes and my evaluation determines that they've had it for 20 years, I know that that's going to take a while.
So what's a while for you?
For
That's
me,
once a week
you know,
for 15 weeks? Or
Not quite. I don't know if I've ever seen anybody quite that long. You know, I typically, you know, kind of guesstimate 12 weeks, and most of the time, you know, it's quite a bit less.
Yeah.
I have one marathon runner who understands that he does traumatize his body all the time. He comes for 3 to 4 visits and then takes about 3 or 4 months off, and then he hurts himself again, and then he comes for 3 or 4 visits. And we tweak whatever we need.
So it's very dependent on what their activities are.
Absolutely.
You know, what it is that they're doing in between times. So how about, I know one of the things that I've had patients, you know, they've had to call the office and say, I need to take a hiatus from seeing, you know, for chiropractic care. So do you recommend that they don't go through any other types of treatments during that time that you're treating
Fabulous
them?
question. Tom Bowen would tell you don't do he would not even take somebody if they were doing anything else.
Okay.
I practice real world Bowen.
Yeah.
Because I feel like chiropractic is necessary, massage is necessary. However, I do have them try to space it out. I have patients, you know, the typical people that come find me are probably the same. They're advocates for themselves.
Yes.
They have a chiropractor, they have a massage therapist. So I just try to, you know, spread it out as best as possible. Or say we're at the point with my patient where we're going once a week, or once every other week, I'm sorry. They'll sneak in a chiropractic adjustment in between.
Yeah.
But what I think is really great is to get someone, a chiropractor that's on board, because wouldn't it be, I've had people say that their chiropractor was like, what did you do?
Ah.
Because they were easier to adjust because their muscles weren't kind of pulling it back in. So you were able to get that adjustment stick a little bit longer.
That's wonderful.
Yeah.
I mean, that's
I
the
think
hardest
it's
thing.
really great to have collaboration. And I've also had the same comments about massage therapists. In fact, I think that I've had a couple of clients go to a massage therapist and she's like, what are you doing? And then she's actually gone to study a little bit to learn some Bowen. There is some massage therapists in our area that are doing the Bowen work.
That's wonderful. So is there other treatment that you'd like to show us today?
Let's see. You can work upper body. Let's see. Why don't we have you flip over, Caroline? And we can take that right out. Once you scoot down a little bit. So you're flat on the head. Perfect. because I'm crazy and I never stop, I'm actually an associate instructor. So I can teach a 4-hour intro class. So say you wanted to come in and just learn just some emergency moves, or just to take care of loved ones, or if you want to use it in your practice, I can teach a 4-hour class. And in a few weeks, I'm heading out to California to go, I'm on the track to become a full instructor.
Wonderful.
But the reason I even said that was this is a particular move you would learn in the as an associate instructor. I can teach you this move right here. It's a respiratory move. It's really great for asthma, shock, grief, anxiety, any of those crazy things. Also digestion stuff, because think about the part of the body that we're in. So you would, obviously I'm not going to teach the whole thing because I would want to make sure that people are doing it correctly.
Right.
But very light holding point, which holds the energy in the particular area. And we're working along the diaphragm. Could you take a deep breath in for me? And all the way out. See how gentle it is. This is not quite a traditional move. It's a little flat, like before you saw the rolling move. Deep breath in. And out.
One of the things I see all the time is people breathing
Deep breath in.
not from their diaphragm, but from their shoulders.
Oh, absolutely.
The shoulders come up around the ears instead of getting that nice belly breath. So is this something that really helps
Absolutely.
release and
And
allow
that
the
last-
diaphragm?
The last move that I did, I can actually teach the person to do on their own, or I've actually taught a mom who brought her little guy in for severe asthma, so, and coughing at nighttime. So she would do that every night, and she would report every time it would less and less. So
Wow.
we call it the rescue move.
Yeah.
My husband actually asks me to do it at nighttime sometimes if he's having trouble falling asleep. Could you do the rescue move?
Nice.
So yeah, and then there's the chest procedure. That would be really good for what you were just talking about. There's all kinds of shoulder moves. I've been studying for, the main course of work is 7 modules, and those are each a weekend, and a 3-day test. So they're very serious about making sure that we are doing the work as it was supposed to be done.
Yeah.
So they don't want anybody to kind of stray. So it's really cool. And then I've done some advanced classes since then. So a lot of stuff we can work with digestion, some gallbladder moves, ileocecal valve. I mean,
Yeah.
I actually have a bedwetting procedure that I have that's been successful for a young child,
Wow.
a couple of young children actually. We actually have a fertility protocol that I've had success with. So
that's
very
fantastic.
neat. Yeah.
Just to go back, the ileocecal valve that you're talking about, that is in, that's actually the junction of where the small intestine and the large intestine come together. And it's a huge area as far as problems with digestion. So it's wonderful that you work with that. I mean, in our American diet, I mean, digestion is one of the number
Absolutely.
1 issues that we have.
Absolutely.
Which that would be a great segment, Nicole.
Oh, it's coming. It's coming for sure.
Wonderful.
But
Are we all set with Carolyn?
I think so.
Thank
Thank
you
you
so much.
Thank you so much. I appreciate it.
So to close out our segment today, what would you like people to know about the Bowen treatment and about, you in particular using that type of
Well,
treatment?
it's super gentle. And one of the big things I think that I want to focus on, especially this year, is trying to educate people to seek it out before you're in that, I've had it for 6 months, 1 year, 2 years. Why not come when you're not quite feeling yourself? I have some patients now that come see me. They'll call it, oh, I need my tune-up. So we joke about it being the tune-up.
Nice.
So just be an advocate for yourself. That's my biggest thing. It doesn't even have to do with Bowenwork. Just really start listening to your body. You know yourself. You're the only one that knows yourself.
Yeah.
And you know when something's not right. So, it doesn't mean that Bowenwork is your answer. Like I said, it's not a miracle. And I don't think every single person has had 100% success leaving me. I think that everybody's had some changes, so that's pretty incredible. But
anytime you can affect the body, that's what it's all about.
Absolutely. It's pretty wild.
So early intervention, that's
Yes,
what you're saying. Early
absolutely.
intervention, get there early. What I say to my patients is when it's whispering at you, not yelling at
Oh,
you.
I love that.
So early
Wonderful.
intervention, maintenance, so after the treatment, and then they go out in the world and whatever activity that they're doing that re-injures or re-traumatizes the body. You were saying inflammation, lymphedema, where you get that buildup of lymphatic where it doesn't
Absolutely.
drain in extremities.
And I
or
love
other
my,
areas.
my athletes and my orthopedic people.
Yes.
So I think that it helps prevent, you know, an athlete always has some sort of injury or a pain or a tightness. So there's always a reason to come see me.
Yeah.
And then I really truly believe that it helps with athletic performance by balancing out the
That's
body. When you're in
fantastic.
harmony inside, then you're going to be able to perform at your best.
Absolutely.
So-
Wonderful.
Exciting.
So thank you so much, Nicole, for sharing that with us today. So I think we'll
I
close
feel like I
out
have
our-
a secret, so I needed to share it. Right?
Well, thank you for sharing that with us.
Thanks. So, thank you for watching Health Talk with Nicole and Dr. Martha. And until next time, but remember, we do have Q&A. So if you have a burning health question, we really would like to hear from you. You can pop on over to www.elitehealthandwellnessvt.com. Over on the right, you can hit submit and you can submit your questions. We'll try to answer as many as we can. You can list your name or not. Again, we'll see you next time. Have a happy and healthy day.
Thank you.
Bye-bye.